Hi, my name is Russel McKenna, and I'm a pediatrician with Yada Yada. I'd like to share with you 7 things that you should know before you take your newborn home from the hospital. Now, this is not an all-inclusive list, but just some of the common things that we get phone calls about after people leave the hospital. So the first thing is, what skin changes are normal, and what rashes do you see? Newborns, they quickly after birth start to develop a rash that looks kind of like bug bites. It's baby hives, and it has a fancy name, erythema toxicum neonatorum. And this rash will wander around their body. It won't stay in the same place more than a day, usually even faster than that. And it may last for days to weeks, but it eventually goes away. You'll see it more intense after you are bundled up with your baby, either skin to skin or your baby's bundled in a blanket. The next thing that babies get are bruises on their scalp. Those usually are not present at birth, but they do develop quickly, and it'll be a bump, and it has kind of a soft center, and you'll even feel kind of a ridge around the edge of it. That's called a cephalohematoma. This usually resolves on its own, but it is quite disturbing if you're not familiar with it. One other skin change that we get a lot of calls about would be a red mark here on the forehead and back here. Now, that has a technical name called nevus flammeus, or a more endearing term, an angel kiss and a stork bite. Those are things that will eventually fade and go away for the average person. Some other skin changes that are normal is a Mongolian spot. These are usually present at birth, and it is nice to note the presence of a Mongolian spot, as if people are not familiar with this, they may accuse you of child abuse or bruising your baby's backside, because that's where it's usually most commonly located. The next question is, how many poopy diapers is my baby supposed to have? And how many wet diapers is my baby supposed to have? Well, your baby may poop quite a bit the first day of life, and your baby may have a few wet diapers. If you just breastfeed, those wet diapers will likely slow down. If you supplement with formula, you'll probably see those wet diapers persist. The poopy diapers, now, if your baby has 5 or 10 poopy diapers in the first 24 hours, or mom is just breastfeeding, don't plan on a lot more poopy diapers until that breast milk comes in. So the most important thing with the poopy diapers is that your baby did poo, yay, so check. The second thing is, as you go home, if the poops slow down and you don't see them, what you should expect to see as the milk comes in is those poops will go from a tar colored to a blackish green color to a brown color, and then end up being a yellow color. And then when milk's fully in and everything's going well, you may see brown, green, and yellow as normal colors. Formula-fed babies tend to continue to poop and have maybe lighter or more grayish green colors to the poop. One thing of note, if you are breastfeeding and your baby stops having wet diapers, and when you open up the diaper where the penis touches it, you might see a rust colored spot on the diaper. It may even have some like a powdery crystally substance. If you see that, it's a sign that your baby is starting to concentrate their pee. And if your milk's not in, I like to recommend that parents consider supplementing their baby for a time after breastfeeding with some formula until breast milk comes in with mom. Another disturbing thing for parents is babies make a lot of weird movements or random movements. When they come out, they might be a little jittery, they might be a little jerky, they startle a lot. Is that normal? Most of the time it is. Every once in a while, a jittery baby might have a low sugar, but most of the time they're just neurologically raw, and they get a little chin that quivers, a foot that, I like to call it a thumper foot, and it just kind of beats. You can usually stop it. A baby that is asleep and jerks their arm, that is normal as well. And if you see movements that are worrisome and they are repetitive, you have a very expensive camcorder in your pocket. So take a video of it so that you can show it to your provider to show them what you're worried about. One thing that gets some dads a little concerned is that my baby boy has breast buds. That is not cool. Baby boys and baby girls do develop breast buds, and they both do develop milk, and that milk can leak out from the nipple, and they can get mastitis. Now, the mastitis is rare, but what I have seen in my practice is if you do see that, it's usually around 2 or 3 weeks of life. What are normal colors to see in your baby? Well, your baby should be more of a ruddy red color when they first come out. They'll pink up a little bit later, and then you might, after 24 hours of life, you might see yellow in the eyes and yellow in the nose and face. And if you do see that, that means your baby is getting jaundice. One thing before you leave the hospital, there usually is a mandatory blood check of that jaundice number, and that is called a bilirubin level. Now, before you leave, it is important to remember that number, but it's more important to remember what should you do with that number. Usually, the nurse will call your provider and they will have a plan of when you need to see your doctor outside of the hospital to follow up on that jaundice number. The earliest it would need to be rechecked usually is in 24 hours, and the latest it would need to be checked would be in 48 hours. Now, if you were told that your baby didn't need to have a jaundice number rechecked or a bilirubin level rechecked, but your baby is looking more and more yellow, more and more like a pumpkin, so that's more orange, you should call your provider and get that checked, even though you were told you didn't have to worry about it. It is not uncommon to have to follow up on a jaundice number in a baby that was a low risk number in the hospital. Other color changes that are worrisome to parents would be blue hands and blue feet. This is very normal. It's persistence of fetal circulation, and it usually resolves shortly after birth. Next topic is a fun one. What do you do with the umbilical cord? And so usually most hospitals will tell you you don't need to do anything. And in all fairness, whether you do something or nothing, it usually gets to the same endpoint, that cord dries up and falls off. So what you want to do is make sure that that cord stays clean and dry, that if you do sponge bathe your baby, you do not get that cord wet, because it will take forever to dry up. Maybe not forever, but it does take a while. If you have a baby boy, you'll want to make sure that you point his penis down so that he doesn't pee up onto the cord. Or when he pees up on the cord, it will make that cord stay wet, but it also encourages it to start to smell. And it's quite an odoriferous moment for your family members when they're holding on your baby and they're drawing attention that your baby stinks. So when your baby boy pees on his cord, it does make it stay wet, and it will make it smell. So if that happens, you may have to help it dry up by using a blow dryer on a cool cycle so you don't burn your baby, or make sure that the diaper does not cover it, because that will only encourage it to stay moist. The umbilical cord usually falls off somewhere between 4 or 5 days after birth, and usually before 2 or 3 weeks of life. Every once in a while, you do have to give that cord just a little gentle tug to help it come off. If the cord is still present and it's starting to look a little goopy, like mucus and blood around the skin where the cord inserts, it's okay to gently pull the skin back and clean that area with alcohol and a Q-tip. The last thing that I share with families is information about hiccups and congestion. So let's talk about hiccups first. Why do babies hiccup? Usually they have a full stomach with air or food. Now, oftentimes moms that are concerned about their baby's hiccuping will recall that they did feel their baby hiccup a lot inside of them. And so it's not uncommon to have that connection where, oh yeah, my baby did hiccup a lot inside of me, so therefore my baby hiccups a lot outside of me. Um, the last thing is the nasal congestion is a concern if your baby can't suck, swallow, and breathe, so they can't coordinate the feeding process because they've got a hard booger in the front that you can see, or something in the back that you can only, something in the back of their nasal passageway that you can only hear. So if you can't see it, ask for some saltwater solution, a normal saline solution, to put a couple of drops in each nair to help soften that mucus. Pray your baby sneezes and blows out a large chunk of hard mucus, because then that solves the problem. But if your baby sounds congested and can suck on the binky and feed, it's probably just noise. You don't need to worry too much about it. You can traumatize the nose by trying to suck out what you can't see, so be careful. Now, those are just a few things that I like to tell parents before they leave the hospital, because these are common questions. If you've enjoyed this, like us, subscribe to us. Thank you.